I want to thank everyone for attending tonight. I want to thank Catapult for allowing me to give this presentation. I've titled this presentation, Your Impression is Distorted. I don't think there's any of us that's been in dental practice long enough that haven't had this situation. So over the years, I've worked very closely with my lab and with the manufacturers, and using, hopefully at the end of the webinar tonight, you will be able to decide on which impression material to use in a particular clinical situation. We're going to start off tonight talking about functional impressions. And functional impressions are your everyday impressions that you would normally take alginate impressions with. One of the things I want to talk about is I graduated from dental school in 1980, so I've been at this a while. And for our crown and bridge, we used alginate for our impressions that we diagnostic models. And also we used rubber base for our crown and bridge. Back in the days where we did our crown and bridge, we would use rubber base, and believe me, it was a mess. We would mix it, the catalyst and the base, on 6x6 paper, and it would tear the paper. And if you got it on the patients or your clothes, you owned it. So we've come a long way. Our dental manufacturers have really responded to our wants and needs, not only addressing the type of impressions that we're taking in the materials, but also the fact about isolation. We're going to talk a little bit about that. So let's start out with functional impressions. What exactly are functional impressions? I consider functional impressions study models, preliminary impressions, perioprotect impressions, for those that use perioprotect. If you don't, I certainly would recommend that you take a look at that. For 6-month smiles, it's a cosmetic orthodontic. For diagnostic wax-ups, if you're doing a smile makeover, the labs absolutely want you to have a great impression. And for Invisalign, one of the questions that was sent in was, what is a great way of taking an Invisalign impression? And I'm going to show you how to do that tonight. And it's a no miss. And then fabricating custom master tray. If you're taking doing a partial denture, which you know, the days of partial denture have declined because of our tremendous success with implants. And also any procedure that you would use an alginate impression. So these are our functional impressions. For years we used alginate. Now, I was never one that really cared for alginate. In fact, I always said that if I had to take a test in taking a great alginate impression, I would have probably flunked out of dental school. That's because, you know, you had to puff, shake the can, you had to get it just fluffy, you had to have the right temperature, and you had to mix the correct water to powder ratio, and you had to make it nice and slurry, and then put it in the tray and place it in the patient's mouth. And the thing that used to bother me the most was not only the mess that you made, but also you had to pour it within a very short period of time. And if you had a busy schedule, someone had to take the time to do that. So I've never been I was never and did not care for alginate as an impression material. It's a great impression material if you like it. But when they came out with alginate substitute materials, I was in heaven. You know, they're polyvinyl, and they were a little bit more expensive. But the beauty of it is that you don't have to pour it right away, and you can do multiple pours. So the material that I've come to like and made by Catapult is Silginate. It is a polyvinyl impression material. It's an alginate alternative, alginate substitute, and it takes great impressions. Again, you don't have to pour it right away, and some of the factors is that it is thixotrophic, it's stable. And here on the screen you can see it comes in either a large cartridge or a small cartridge in our mixing machines. And you know, you can keep these impressions. Once I get my impressions back from the lab, a lot of times I can keep that. I want to keep the models and the impression for a long period of time. So this is what a typical Silginate impression material looks like. One of the questions that was sent in prior to our webinar tonight is one of the people that are listening to the webinar, one of the doctors listening to the webinar, seems to get some drags in the second molar area. and the rep said wait 10 seconds. I went through all of my photos of, and here's how the material comes. It either comes in a bulk pack, an intro pack, and it can be disinfected. And that's another thing that's the beauty of this, is that our labs want us to disinfect, make sure they can disinfect the material. One of the biggest advantages to Silginat is it can be scanned. So it's a great material for that. You can take the impression and it can be scanned later with your scanner. So that's one of the beauties of that. This is the large mixing machine, the auto mixing machine. And that's what we use in our office. Is that, you know, I love this material so much we buy it in bulk. And it's a time saver. But one of the things is that you have to make sure that you have a properly fit and tray. One of the biggest problems, and I'm very close with the labs, is that you know, if you don't have a custom tray, just make sure that your tray allows you to place enough material to take an accurate impression. You can see here coming off the big auto mix. And this is a typical, this is one of my impressions of preliminary impression. And when the question came in prior to our webinar and I looked at it, I went back and I will tell you that I think the problem is in getting a drag off that second molar, and the rep recommended waiting 10 seconds has to do with the surface contact. It also has to do with the way you seat that tray. I have a tendency to seat from anterior to posterior. And I don't seem to get, I have never noticed that I get that drag from that second molar, but make sure also that the teeth are dry. You can have a little moist, but make sure it's dry so that you get a really accurate impression. Now, when I take my functional impressions, I do two different types of impressions. For the maxillary, I use the Silginat, and it seems to work just wonderfully. I capture the palate and everything, and I want to make sure that it's a really accurate impression, especially if you're sending it in for Perio Protect trays, Invisalign, 6-month smile, anything that they're going to do some type of work on it. Also, here shows a custom tray that's being made for an edentulous to take a master impression for a dentulous. This is just an ideal material because you can send this to the lab, they pour the model, and they make it. And, you know, we all try to economically save money and everything, but I will tell you, it is a blessing because when you don't have to have someone pour it right away, you're saving time there. So one of the other areas that I use Silginat, as I mentioned, it can be scanned, is if I'm doing 1 or 2 quadrant units of crown and bridge. I will use it in a triple tray, an inexpensive triple tray, to take a prelim impression. And from this prelim impression, it's what I make my temporary in. So if I'm doing a single unit or 2 or 3 units in a quadrant, I'll take a prelim, and then I'll take the temporary material and reseat this into after the impression for the final prep. And this makes a beautiful temporary. It is so easy to do. I always share with doctors how I go back to the days where we used aluminum temporaries out of the box or in the anterior. We used pick a temporary out of the box and fill it with jet. But nowadays with the acrylics that we have for our temporaries, this makes it so easy to do, and it doesn't take long at all. And you have very little trimming you have to do. A lot of times, if it stays on, you don't even have to cement it on. So it's a great material for using for that. I see there's no questions, so we'll continue on here. Now, one of the biggest problems, and again, this one of the questions that came in is, how do you take a really accurate Invisalign? So I just showed you how to get a really good impression on the maxilla using Silginat, and it's very, very, very accurate. One of the biggest problems is that in taking a mandibular, you have the tongue and saliva. So I'm going to show you a foolproof, and I mean foolproof, way of using an impression material to take a mandibular impression that you won't miss. You're going to do a putty wash. Panasil makes a putty by Kettenbach. So what I do is I take a putty wash. Okay, so we first of all mix the putty, And this is the putty. This is what the putty looks like. It's Panasil putty. It sets in about 2.5 minutes, 3 minutes. You'll mix the base and catalyst, place it in the tray, and then place it, let me go back here, place it in the patient's mouth. After that sets, you're going to take the Panasil Initial Contact Extra Light. And this is a fast set. This sets in 2 minutes. So what you do is you're doing a wash with the light body right over that putty. And I will tell you, you will have the most beautiful impressions that you ever want to see. And you don't have to worry about the tongue. The saliva won't be an issue. I have a couple of questions here. What do you recommend for sleep appliance TMJ for impressions? The same thing we just talked about. You can use the Silginat on the top. I have made a number of sleep appliances, and I send it right to the lab. And then I would do the putty wash, the wash being the extra light fast on the bottom of Panasil. It works wonderfully. Thixotrophic talks about the contact surface and how easy it is to remove off of the tooth so that it doesn't get locked on. It's very elastic. So that's what that is all about there. Can't Silginat be used as tray type material and take a wash in it? I have never used Silginat as a tray material. I prefer to use and then a wash. It is a polyvinyl. I've actually never tried that. But one of the things I want to share with you is one of the questions that came in is to take a prelim for crown and bridge. You take a prelim polyvinyl with a heavy body before the prep. You prep the tooth, and then you reline that with a light body. I will tell you, because of my relationship with a number of labs, and I work with the lab, I consider my lab technician one of the best there is. He's incredible, ceramist. But one of the largest areas of remakes of crown and bridge is when the doctors would reline a heavy body or a tray material that they took prior to prep. They don't marriage, what I call marriage together. They don't come together in a homogeneous type situation. Now, I know we just talked about using a putty, but that's just for diagnostic models. It's not crown and bridge. It's not the accuracy of the impression that is needed that you have for crown and bridge. So I've never done a wash with that. So another question, it seems like the putty wash would be more accurate than the Silginat. Is that true? It can be true. The reason why I like the Silginat, I actually use the Silginat on the maxillary and the mandibular. The reason I like the Silginat on the top is because of the flow and capturing the palate. It seems to flow a lot better. Any issues with Panasil net adhering well to the putty? No, I have never had that. I mean, you can actually peel it out if you need to. I've actually done that, but I've never had a problem with that for a diagnostic model. Remember, this is a diagnostic model, and you're good. Yes, you're going to use it for 6 months smile. You're going to use it for Invisalign, but I've never had a problem, and I've used it many times with that. So let's go on here. So this talks about the Panasil initial contact properties. And when you use a putty, I use the extra light that you can see right here, the extra light fast. So it gives you plenty of working time. You reintroduce it, and it works wonderfully. Get a chance, try that. So this is what it looks like. What I did was I took the color out. The dark color is actually the putty. The light color is the wash. So it's pretty cool to see it like this in what you're going to pick up. So the putty actually gives a pretty accurate impression, but you don't have to worry about, again, the saliva and the tongue, and it gives a really accurate impression. And again, the reason I like the Silginat on top is because it flows, it gets the palate and everything. So now let's talk about crown and bridge. I'm real strict about the impressions that go to our lab. I have spent a lot of time in dental laboratories. I go back years where I've actually seen doctors send alginates into the dental lab for crown and bridge, actually for bridges. And I've seen, again, one of the largest areas of remake is to take the prelim in a tray material and then after the prep reline it. They don't marriage. So, you know, one of the things that we want to do is this is the Panasil family that you have available to you. One of the things I want to talk about is when do you use a fast set for crown and bridge, and when do you use a regular set? Fast set being a 2-minute set, a regular set being a 4-minute set. And I will tell you that if you have more than 2 preparations, I would not use a fast set. And the reason for that is because of just the set time. Chances are you're going to get some type of distortion. And the sad part is you don't always notice the distortion. But when we go back and we study as to why the distortion took place, a lot of times, if you got more than 2 preps, a lot of times it's because the impression material starts setting before you really got the tray material or the body material on it. So that is something. These, again, are the types of impression material. So one of the things that we talk about is accuracy. And this is a saying I have. There's no single procedure that a dentist can do, or any single procedure that a lab can do for the dentist, that will improve the final results of an indirect restorations more than improving the quality of the impression. The impression is the basic starting point for all laboratory procedures, as well as the basis for quality and cost-effective dentistry for the clinician. So basically what I'm saying here is that if you take an impression and it isn't right, the lab technician, our lab technicians are so nice, some of them, they don't want to call the doctor back because they don't want to lose the business. If the margin isn't there, they can't make a margin for you. So if it's not right, take the 5 minutes and take the impression over. It's real simple. Maybe it's isolation. Maybe it has to do with, you know, some blood got in the area and it's not dry. But just give them. I have a saying that goes like this. If you send garbage into the laboratory, you're going to get garbage out of the laboratory. Excuse me. Okay? So garbage in, garbage out. The laboratory technician can only give you what you give them. So you got to remember that. Just, you know, be professional about it, you know, and have a great impression. With the way we can isolate the materials we have nowadays, there really are very, 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 very few exceptions. And believe me, I understand when it's deep and it's deep in the sulcus and everything. The other thing that we want to talk about is the importance of the tray and isolation. I actually stopped packing cord in 1997. I do use a laser, but I do remove old PFMs, deep amalgams, deep restorations, and I use a laser. In the anterior, when I do a smile makeover, I make sure the gum is healthy. Again, my lab technician is so good that I barely get below the gum, the gingival height for my restorations, and they come out beautiful. So let's look at how important is the tray. The tray is the carrier of the material. And again, if there's a distortion, a lot of times it has to do with the tray. Make sure you have a properly fitted tray. What we do is we actually try the tray in prior to us prepping, because we may need to, sometimes you need to fit the tray to the mouth. Sometimes you need to put it under warm water and contour the tray. So let's take a look at different situations in crown and bridge. We have single units, multiple units, bridge, implants, and full mouth. We're going to talk about those a little bit. So one of the questions that came in is, do I believe in triple trays? I do. A lot of people, if you do a little research and look up Power Bite, I do like triple trays for single units or 2 units, and also for second molars. Now, if you're prepping a second molar, always take an impression prior to your prepping, because we all know that second molar is the back of the hinge. You can reduce a millimeter and it still looks like the teeth are touching, and it just relieves the bite. So you want to make sure prior to prepping a second molar, you definitely, and you should anyway for your temporary. But I do like triple trays because they give a power bite, they give a really accurate. The problem that comes in is the doctors need to make sure when you have that patient bite down in that power bite with that triple tray, because of the anesthetic, especially if it's a lower, they don't always bite into their proper CO. So you have to check always check on the opposite side and make sure they're teeth, because before I even prep the teeth, I make sure I see what that relationship is. And that's the distortion. A lot of times also we will take a bite after we take the impression out to send to the lab. Multiple units, we use full arch trays. There's no question. Single units, again, we can talk about, we can use fast set, but multiple units, we want to use a regular set, the 4-minute set. In bridges also. With implants, I use regular set, and of course full mouth, same as multiple units. We use full arch trays for all those, just because you should. Just take the time so that they can articulate the model properly. And it saves you a lot of time when your lab technician has a properly articulated model to give you a good restoration and occlusion, so that you don't spend a lot of clinic time adjusting that bite. So a goal of an impression, what do we want? We want to create a dimensionally exact copy of the clinical situation, including the complete void-free and precise reflection of the margins. In a slide here in a few minutes, I'm going to show you where I did a full mouth reconstruction and took the impression, and this one of the second molars, it was distorted, so I picked up a quadrant. So you want to give the laboratory exactly what is in the mouth after your preparation. You want to give them an exact copy of that, void-free, and that way they can give you exactly what you want. How do we do this? What I do is I use, if I need to, I use tray adhesive. Now, some of our disposable trays, they have holes. All the margins must be visible. You know, we have so many ways nowadays to isolate and to stop bleeding, that, you know, we have different stats, we have different cords, we have, you know, putties that we can use down into the sulcus to stop this. So let me go back to our questions here a minute. Are you two-stepping the putty wash? Yes, I'll go back. Why am I getting pullback and distortions on interior with putty and extra light impression for Invisalign? I've not seen that. Make sure, the question that I just received is, why am I getting pullback? Make sure that the putty material fills the tray and that you seat that putty. When I seat the putty, I seat it the same way, anterior to posterior, and make sure that you've given it plenty of working time and setting time. And then what I do is just reline that with a 2-minute set. So I'm not seeing that, but make sure you're seating it right. And also, the light body should fill in wherever there's a void. Do you recommend using all the same material from one company? Yes, that's a good question. The question is, do I recommend using? Please do not mix different companies. Like, don't use a light body from one company and a heavy body from another. And it's the same thing even when you go to submit your restorations. Use the same chemistry from the same company. I will tell you that your dental laboratories will tell you that this is one of the areas where they have a lot of remakes. Don't try, you know, you've worked so hard to get it to this point. Don't blow it to this point. In other words, take a good, accurate impression. Okay, so if you can't see them, you will not see them. So what we're talking about, make sure your margins are isolated. Make sure you have good isolation and that you have a clean field, all right? And I'm going to show you how to do that in a few minutes. Use cheek retractors with Vaseline. When I do a full arch impression, I use cheek retractors, all right? And a lot of people don't know that, but it keeps the cheeks out of the way. You can place cotton in there to keep it dry, and right before you put your light body on, and it just gives you good isolation. Try and tray, we already talked about that. Preparation must be clean, rinse. What happens is my assistant, when I go through, and if I have multiple units, I will put a light body down. I'll give a little air on it to go back with another light body. The second time I go back, she is filling the tray. My assistant is filling the tray. And then there it talks about how I use a little air to blow into the impression. And that's very helpful, especially if you have a deep, deep cervical impression. Preparation. And then we actually time, and this is critical. Don't go by feel. Please have a timer on your operatory cabinet or have a timer in the operatory. We time, when we say 4 minutes, we mean 4 minutes. Don't just go by feel. Make sure you time it, just like an etching. Make sure you have a timer there. So you want to make sure you time it, you want to make sure you have good isolation, and you want to make sure you have good access and proper fitting tray. And then if you have trouble removing the tray, and I'm going to talk about that in a few minutes about the polyethers, just take your finger and roll it either on the upper or lower, and it usually allows some air in there and it releases. So this, again, my two favorite materials for multiple units. And I very seldom use fast set. If it's a single unit, I'll do it. But I like the extra light for the initial contact, and I use the regular and the soft. So I really enjoy these materials because they come together. They're both same working time, setting time, and it works wonderful. Let me go to the questions here. Do you use double cord? I do not pack cord. I have not packed cord. Some people do use cord, and I don't go one way or the other. I don't use cord because I think it hurts the patient. If you can tear the epithelium. We have so many other ways of isolating, and I'm going to recommend a way. If you can, try not to prep on bloody gums. That's the thing, is healthy gums. And I realize if I sat here and told you that I don't have bloody gums, I'd be lying. No, we all have bloody gums, but it's how you isolate. I use a laser, a soft tissue laser in the posterior. Most of the time when I do my anterior smile makeovers, I'm using the laser anyway to give proper gingival zenith and height in position. So I use a laser, and I also will use some type of statins I'm going to show you in just a minute. So these are the Panacell initial contacts. I like the initial contact regular set, and that's what it looks like. Here's the extra light fast, and this is the soft tray material. So this is, we have in a bulk, we have it in our machine. While the assistant pushes the button, fills the tray, I'm putting the initial contact light regular set on there. So one of the things that I use if I have bloody gums is I use Viscostat. Viscostat is an Ultradent product, and it's really, really good. I like the clear, and what I do is I tell the patient I use an infused brush with a syringe. Of course, everyone knows Ultradent is the king of syringes, and I just place that on that gum, and if it's bleeding a lot, I'll dab it a lot and put a gauze on there and let it set for a few minutes. I don't have to pack cord, and it usually, I will tell the patient it may taste a little bitter, and we go from there. Says a question, I see the putty and wash on top of it at the same time for Invisalign impressions. Is this not correct? If it's working for you, great. Yes, I've actually done that with Crown and Bridge. A good friend of mine, Rice Bourne, James Clem, we used to do a lot of things together. And what we did was just put the tray material in the tray material, and this is for Crown and Bridge, and the light body on top. If it works for you and you're getting accurate impressions, that's great. You can do it that way. I choose to, and you actually will probably get a better marriage between those, but I choose to do the putty first with a wash. So, but you can do it that way. One of the things I also do when I'm done prepping is I use a product called Super Seal. It's made by Phoenix Dental. It was founded by Charlie Cox, and many of you may know Charlie Cox is a pulp biologist. In this company, they don't even know I push this material, but I know the family very well. But what it does is a desensitizer, but it also takes the smear layer. One of the questions that came up, how do I eliminate drags and bubbles in Crown and Bridge? If you call this, here's the phone numbers on the screen there. If you call them, say, hey, you heard me speak, they'll give you a deal. If you just take a little micro brush, what you do is you rinse, you dry, you're getting ready to take your impression, you're getting ready to put your light body on the prep, take a micro brush, a Super Seal on it, and just rub it on the prep, and it gets rid of the smear layer. It kind of gives a little etch factor to it, but it also desensitizes it. And you just dry it. Don't rinse it, just dry it. I guarantee you will eliminate your drags and your bubbles off your impression. It comes out every time. This is what a typical quadrant impression will look like. You can see the light body with the tray material. and it comes out just beautifully. This here on each side, and again, you notice there's multiple preps here on different sides of the quadrant. Definitely an indication for a full arch tray on that. And here is a patient that I recently worked on where we had an implant in the front. You can see there's good isolation. You can see those margins. Nice shoulder prep there, chamfer shoulder. And I give my laboratory technician, I'm very proud of this because my laboratory technician will use this to share with other dentists the type of isolation they want. And, you know, this is ideal to show it with an implant. So you can see good isolation here. And this is the Panasil light initial contact with a tray material. Here's a little closer up, magnified a little bit. And you can see it here on the lower, same patient. Now, one of the things I want to show you is this is a full arch impression. You notice down here where you can see the arrow, I have a distortion here. I have a tear, and that happens. So what do? Do we say, send it to the lab and say to the lab technician, hey, just go ahead, you can force that, or you can fudge that? No, we'll do a pickup. Just do a quadrant, just a plain quadrant pickup. It only takes about 5 minutes. But my laboratory technician doesn't have to wonder where the margin is. And that happens. You know, you want to make sure you cover your behind and you give them exactly what they need. So we've got good isolation. We've got good impression. Now, Catapult recently came out with the best of two worlds. For many of us, we have worked in the past with polyethers. The problem with polyethers is they were so rigid and they would get locked on. And that's the thixotropic part. So Catapult came up with a combination of a polyether and a polyvinyl, and it's called vinyl siloxane ether. It's Identium. And I just started using Identium, and it's unbelievable. The beauty of a polyether is that you can have a little bit of saliva, a little bit of water in the area, and it will not affect it. So please take an opportunity and grab a tube of this and try it. You will absolutely love this stuff. It's accurate. It's at low contact wetting agent, which we all, in the final hardness, it just sits unbelievable. And this is what I probably feel is one of the best, if not the best, impression material out there right now. Here you can see the impression magnified. So it has extra flowability. It's hydrophilic. Again, you can have, that's the beauty of the polyether. So it has a polyether, polyvinyl characteristic all in one. Let me see if we have some more questions here. What brand of soft tissue laser do you use for succular prep? You know, there's a lot of great lasers out there. And, you know, for me to say one's better than another, I would not do that. But there's a lot of great diode soft tissue lasers out there. And once you start using laser, the beauty of a laser is a lot of people kind of think of electrosurge, but it's not. Remember, when you laser something, it heals immediately. If you were to do a smile makeover and adjust the gingiva with electrosurge, you would have to do it a week or two beforehand because it doesn't stay in that position. It has to heal. The beauty of a laser is when I remove a deep restoration like a amalgam, composite, or PFM or a crown, and there's bleeding down there because of irritation, especially with PFMs and amalgams, I always tell patients that they can be the best flossers in the world, best hygiene in the world, and they'll still have that bleeding because of the oxidation of that metal of the PFM. You want to get rid of that diseased tissue, and that's why I like using that diode laser. So there's a lot of good ones. There's portable ones, and AMD makes a good one. Denmat has a portable one that I really like. There's all kinds of lasers out there that diode lasers, and they're not expensive anymore. They're getting really down there. elementary question, if your syringe time was really quick and you did not use all the working time, is it material really set in 2 and 2.5 minutes? If you're using a regular what I call a regular impression material, it's a 4-minute set, and you should time that. You know, you got 2 minutes of about 2 minutes of working time, and then you set your tray in there. So you should make sure, and I'm not sure if I answered the question properly, use all the working time. Yeah, you want, and I'm not sure if you're talking about a quick set, a fast set, but the fast set is set in about 2.5 minutes. If I use a fast set like for a single unit, which I very seldom do, I prefer regular set. That gives me enough time. I know the materials are coming together, and I'm just a regular set person. Why in either? Okay, so I talked a little, what's the difference? What's the advantage of polyvinyl, polyether? Well, now we have Identium, which is a combination of the two. Polyvinyl has to have good isolation. Polyvinyl is a great impression material, very accurate. It's been our keepsake for years. It's been what we've used for years. A polyether in the past has got a bad rep because it's just so rigid. It gets locked in and undercuts. But now, with the elasticity of introducing the polyvinyl, and also we've also changed the characteristics of the polyether, you can use that material around areas where you can't get good isolation. An example of that would be the first, second molar mandible. Mandibular, if you're going to take an impression, you know that the tongue can come up and all of a sudden a pool of saliva comes up. Well, with the polyether, you still get a really good, accurate impression. So we're going to move on here. One of the impression materials that is forgotten, I feel is forgotten in dentistry today, is monophase. Monophase is a great impression material because you don't need to introduce a light and tray material together. So one of the areas that I like to talk about in the monophase is where to use it. Again, it's one phase, it's versatile. You can use it for complete removable dentures. And that's what I use when I take my master impression. And I'll show you a picture of that. You can use it for all on 4 when you're taking an impression. Removable partial dentures, you can actually use it. There's a study that was done between a monophase and a light body and a tray material, and there was no difference in the dyes in the outcome of the crown and bridge that was made. And you can use it in functional impressions, what we talked about, diagnostic models. One of my favorite places to use it is on implant pickups. If you're doing a single implant pickup or multiple implant pickups, it captures the tissue, it captures the surrounding, it captures the gingiva, and it's a great area to use. This is how the Panacil monophase comes. Again, all their impression materials, or most of them, will come in a bulk and also in a cartridge. And this is a typical diagnostic impression. So you can actually use this as just like you can use Siljon. We had monophase before we had the alginate substitute material. Here's one of the impressions of a complete denture. Now, what I do is I actually, instead of border molding with with stick compound like many of us learn, I actually use the putty. I use the Panacil putty, and I'll put it on the custom tray, and I'll place that in the patient's mouth to get my border molding. And there's arguments about, do you need a posterior seal? Do you not need a posterior seal? But I'll use it back there. And then I will introduce the monophase into that, and it takes a beautiful, beautiful complete denture. So you use the Panacil putty for the border molding, and then the monophase. So one of the areas I want to talk about tonight is our bite materials. Kettenbach makes a number of different bite materials, and they've responded to our needs. And the deal is they have different set times, and they're used in different materials. If you get a chance, take a look at their different bite materials. I'm going to show you here a second, excuse me. This is the Futar Fast. They recently came out, and I'll show you an example of a Futar Clear. The Fast material sets, one of the things is that you sit there and, we get done with our preparation, and we have to take a bite record. Or if you're doing a diagnostic model, you do a bite record. So this is the material. The bite registration material is called Futar. This shows it in the mouth. One of the things I do when I do a symmetry bite, when I'm doing a smile makeover is I want to give my laboratory technician a relationship between the dental midline and the facial midline. This is called a symmetry bite. This symmetry bite is by clinician's choice. It comes with a vertical stick that is white, but I use a Benda brush because it's more firm. And I take that impression. You can see here in this photo that the patient it's right down the middle of the face. And when you take that picture, you want to share that with your lab technician. And this is what it looks like. So what we're going to do is when we do the diagnostic wax up, or if we've done the preps, we can see we're going to try to line that dental midline and facial midline. I'm going to go here to some questions. Can you explain how do you do the quadrant pickup with the last full arch case? Quadrant pickup. Oh, I'm sorry. So when I took the full arch impression, I had a distortion of that second molar. So all I did was I took a quadrant tray and I just put light body, and my assistant put tray material in there, and I just seated it. Now, when I seat that, first of all, I try the tray in because we all know that quadrant trays can get distorted. When I seat that, I hold that with my hand. I don't let the patient bite on a cotton roll. I hold that for that whole 3.5 to 4 minutes. So have you ever tried Traxident? Yeah, Traxident works. Sure. It's an isolation, and I call it like a putty. When should monophase and medium bodies be used? I just showed some examples. Monophase can be used I use it in my pickups for implants. I use it for my dentures, my partial dentures, and you can actually use it for all on four. You can think of a monophase as it's very accurate, and also in diagnostic models. All right, for your complete denture impressions, I use the monophase. So here's the Futar bite registration again. This is the clear material. Now, one of the things we all know is that when we go to take a bite on a patient, we're not sure. We can't always tell if they're biting into CO, if that's the position we want. So Kenbach came out with a clear material. You can see it here. There's some saliva there. You can see it here, and you can actually see through this material. I have friends that are using this also for making temporaries in a tray. They take this as an impression, and they can see it, that it's seated properly. So you can see that the patient is biting properly, and you got a good relationship. It's a great material. And here I just had the patient open and take a photo, the previous patient. So one of the things is I talked about earlier is temporization. Here a quadrant prior to preparation, and we use our temporary material. And we just actually flow the material in there and reseat it. Here you see me doing a full mouth and an anterior. Kettenbach's temporary materials, Visualis, it's fantastic material. It's bisphenol free. A lot of patients, they know this stuff. They want to make sure that they're not getting the chemicals they don't want. But this is a Siltec impression that is made off a diagnostic wax up, and I'll show you how I seated it. This is David, and I did this in front of a number of lab technicians. Seated it, let it set for about 1:50 to 2 minutes. Remove it, and I'm not kidding you, that's how it comes out removed. We get lucky once in a while, we don't have excess. So here you can pull the silt off, check the bite, recontour, and that's what it looks like. Now you can see some bleeding here where I did some gingival recontouring, but that's pretty nice temporary. Now I don't cement these temporaries. These temporaries are locked on there, and they stay right on there. And sometimes you can get real fancy with it. You can use glaze, we use Color Plus. Here you can see blue for some translucency on the temporary. You use white for halo, yellow for ochre around the gingiva, and it comes out pretty nice. So a lot of times patients will say, can I just keep these? When border molding, do you put the putty all over the custom? No, I just put it on the margins on the tray on the outside. Now when you introduce that and you pull the lip down and you do your border molding, the material can go inside the tray. Just leave it. It's fantastic. Then you put your adhesive on, tray adhesive on, and introduce the monophase. It's great. It's great. It works great. What do you use for the temps? I use the Visualis by Catapult. I'll go back there a second. Show you. Let me see here. Right here it is. There you go. Right there. Great impression material. There's a lot of bisacrylics out there that are good. And you just introduce it, you massage it, 1.5 to 2 minutes, check the bite, and then do contouring, and you can do some customization. Okay, so I'm part of Catapult Education. There's about 18 of us speakers. So if you ever have a study group that needs someone to come out and give a presentation on different topics, contact Catapult, and we'll make that happen. So this is my email address and my phone number. Please feel free to call me anytime. I don't always know the answers, but I certainly will work with you on it if I don't know it, or I'll find out. But this is a lot of fun. I get to do it in a home. I wish I could see all your faces. But anyway, this is my email. If you ever have any questions or anything about aesthetics, about impressions, about bonding, don't hesitate to email me or call. And I want to thank you all for this evening. For some of you, it's about 6 o'clock. For others of you, it's about 9 o'clock. Let me make sure I got through all the questions. What 5 takeaways a practice should do now to improve their impression technique in their office? One is be consistent in the type of materials you use in the impression. In other words, make sure you have good isolation. Make sure it's dry. Make sure you give your laboratory the best impression that you can give them. And you know, the lab technicians, talk to them about it. Say, hey, how can I improve? I have a relationship with my lab technician that's incredible. We're partners. My lab technician makes me look good. I couldn't do what I do without my lab technician, you know, and they're fantastic. And, you know, it's with the materials we have nowadays, try the Identium if you get a chance. But, you know, make sure you have good isolation. Make sure that you know, when you get down, you've worked so hard to get a nice prep. Don't blow it here is what I always say. But use the same company, the light body and heavy body, and make sure, and also try the Super Seal. It's amazing. Let's see. Great material, Dr. Tomaro. Thanks to sharing for your knowledge. You're welcome. Thank you. I enjoy this. Anyone that knows me knows how much fun I have.